Hi guys, I'm Matt Best and welcome to my vlog. In this vlog I will be addressing skill and capacity issues in athletes performing back squats and the Romanian deadlift. In this first clip, the athlete completes the back squat with poor depth and control. This highlights an apparent skill issue due to the poor motor control during the exercise. The unfamiliarity of the patterning reduces ability to sit back into the squat to gain greater depth. The athlete compensates through various joints to try facilitate the movement, which is shown by the athlete shifting his body to the right and increasing the external rotation of the foot on the descent phase. To determine whether this was a capacity issue through mobility of the ankle and hip, objective measures of dorsiflexion and hip internal and external ranges were analysed. These tests provided evidence of no mobility issue, reinforcing that the athlete has a skill and motor patterning issue. On side view, the athlete shows a great tibial progression angle, as well as slight hip flexion angle on descent phase. This again highlights the inability to sit back into the squat, and these variations in the athlete's patterning is his compensatory mechanisms to aid balance over the base of support. To improve these motor control issues, accessory exercises were introduced. Firstly, the pole squat was implemented to facilitate the descent phase and optimize the range of his hips without compromising the tibial progression angle. This exercise is great at dissociating the hips, reinforcing better motor control. Following the pole squat, light external loads were implemented with the reformer. This squat variation allows the athlete to drop into the movement pattern with better trunk positioning, as well as achieving parallel and optimal depth. The next two accessory exercises are cued by commanding athlete to sit back whilst keeping chest tall. The band assisted squat decreases tibial progression angle whilst optimizing trunk positioning and depth. This will reduce shear force of the lumbar spine as well as at the anterior knee. The goblet squat variation causes athlete to balance centre of mass differently whilst remaining in upright trunk position. This load and exercising again reduces tibial progression angle whilst optimizing depth. These accessory exercises target the athlete's skill in the back squat by implementing good movement patterns, reducing hip flexion and tibia angles, and improving overall depth during the squat. The next athlete in this vlog demonstrates a capacity issue during the back squat. This athlete shows good starting position of the back squat and attempts to squat with optimal form and depth. However, on the descent phase, the athlete compensates with various movement strategies to achieve completion of the squat. The athlete shifts his body to the left and distributes the weight onto his forefoot. This is shown by the heel raising off the floor on his left hand side. This side shift is shown also by the bar being uneven and slanting towards his left side. The athlete also compensates by flexing his hips and increasing lordotic posture to achieve greater depth. It is fairly apparent that the athlete is implementing a strategy to offload his right knee whilst trying to achieve correct form. On side view, the athlete achieves vast tibial progression angle before hips are at parallel. Further examination of this athlete highlights a reduced ankle dorsiflexion range bilaterally through knee to wall lunge testing and restriction in knee flexion through pain inhibition. The athlete also presents with reduced quadriceps and glute strength. Coaching cues to keep chest tall or drop the hips back and flex at the knee would not aid this athlete to reduce compensatory mechanisms. The issues of the athlete is of joint mobility and specific strength deficits. Accessory exercises implemented was firstly to address mobility issues of the athlete. This banded knee to wall drill helps talocrural joint range of motion by mobilizing the talus to glide into the mortise. As well, the athlete has been advised to squat with weightlifting shoes or with plates under his heels. Implementation of gluteus activation was achieved by the standing fire hydrant drill. The athlete's glute activation through variations in hip movement will help reduce the side shift during the squat, as well as improving the capacity to contract the glute max when squatting to or below parallel. The final accessory exercise implemented was isolated knee extension coupled with blood flow restriction. This was implemented to improve quadriceps strength on the right hand side without compromising the joint. Blood flow restriction training also creates a pain relieving effect, reducing pain inhibition on that right hand side. These accessory exercises target the mobility issues presented by the athletes and targets the strength deficits of key muscle groups. In this next series of clips, I will be examining an athlete with a skill issue when performing a Romanian deadlift. The athlete in this clip presents with a lack of skill when performing the RDL. Firstly, the athlete takes time to stabilise and find a comfortable or optimal position to perform. Furthermore, the initiation of the movement is generated by a lumbar flexion strategy without forcing hips backwards. This in turn causes an increased lumbar stress, resulting in reduced range. The technique presented by this athlete also shows incorrect bar path and positioning. The athlete, being unable to drop his hips backwards, creates a more dominant lumbar flexion strategy, resulting in the bar moving too far forward to the athlete, again resulting in reduction of range. Objective markers were used to examine hamstring extensibility to enable to rule out a capacity issue with this athlete. The active straight leg raise was examined and adequate extensibility was present. Sit and reach test was also implemented as well, again resulting in adequate markers. Overall, this athlete presents with a poor skill and patterning to hip hinge and inability to control centre of mass by inadequate bar path. To help this athlete to improve his skill and motor patterning, coaching cues can be applied. Cues such as bend at your hips and keep the bar close can help reinforce the athlete to drop hips backwards and more posteriorly. Accessory exercises implemented was to address the skill and motor patterning of the athlete. This first clip is a basic wall drill to help dissociate the hip and reduce stress on the lumbar spine. This exercise reinforces the cue at bend at your hips, as it is a hip hinge exercise. This next exercise is a loaded horizontal hip thrust. This exercise removes any lumbar stresses as well as helps reinforce a hip hinge patterning. Finally, another variation of the hip thrust is the vertical hip thrust. This exercise creates further demand to hip hinge and to combine some trunk stiffness to remove any excessive lumbar lordosis. In the next series of clips, I will be addressing a capacity issue during an RDL. The athlete in this clip shows good starting position of the RDL and shows good bar positioning close to his body. However, the athlete demonstrates poor depth and range of this exercise. It is apparent that the athlete has a good level of skill but poor capacity to perform the RDL. Further investigation of the athlete's hamstring extensibility highlights inadequate range on his active straight leg raise and a very poor outcome measure on the sit and reach test. These two tests highlights the hamstring extensibility being a major issue within this athlete. To reinforce that this athlete has a mobility issue, a passive straight leg raise test was used, which indicates the hamstring extensibility being the prime reason for poor capacity during the RDL. Coaching cues would not be sufficient to eradicate this mobility issue, however a number of mobility and passive interventions may be useful. The exercise of a hamstring extender is a useful drill to reduce neural tension and improve hamstring extensibility. Also, mobility exercises and interventions such as foam rolling and active release techniques can help improve short-term extensibility, allowing for improved range when performing the RDL.